Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.
Estrogen health and common myths. Health comes first. When we talk about estrogen, yes, the goal is building as much muscle as possible, but none of that matters if we can't stay healthy long term. If we can reduce risk without sacrificing physique progress, we absolutely should. The good news, healthy estrogen levels don't hurt progress. They enhance it. Estrogen is neuroprotective. One of estrogen's most important roles is neuroprotection. At normal levels, testosterone is neuroprotective. But that protection does not come from testosterone itself. It comes from estrogen. When aromatase inhibitors are used and estrogen is suppressed, testosterone becomes more neurotoxic. Non-aromatizing AAS compounds show greater neurotoxicity because they do not convert to estradiol. Aromatizing activity in the brain is essential for neurological health. Kidney and heart protection. Estrogen is also renal protective. Steroids increase oxidative and inflammatory stress in the kidneys. Estrogen helps reverse that damage. The same is true for the heart. Low estrogen contributes to cardiac inflammation, fibrosis, structural remodeling. This leads to left ventricular hypertrophy and cardiomegaly, a major issue in bodybuilders. Estrogen directly counters renin-angiotensin-aldosterone signaling, one of the biggest drivers of cardiac pathology. Cholesterol, bone, and brain health. In studies where testosterone was used with or without an aromatase inhibitor, HDL dropped significantly when estrogen was suppressed, allowing estradiol to rise dramatically, improved lipid profiles. Estrogen is also bone protective. Suppressing it reduces bone mineral density, especially relevant for female competitors. Brain health matters too. Chronically low estrogen has been associated with cognitive decline and dementia risk. Liver, insulin, and sexual health. Estrogen protects the liver by reducing visceral fat and fatty infiltration. Low estrogen increases insulin resistance, something competitors cannot afford. Sexual function is also estrogen dependent. Penile tissue and key brain regions contain aromatase and estrogen receptors. Too little or too much estrogen can impair libido and function. Balance matters. Estrogen and prostate cancer. A common myth is that estrogen causes prostate cancer. That's not accurate. Prostate issues are driven by inflammation, oxidative stress, aging-related androgen decline. Estrogen alone is not the cause. Maintaining a healthy androgen to estrogen ratio is protective, not dangerous. Water retention, the real story. Estrogen does not directly cause water retention. It shifts fluid compartments. Estrogen lowers the threshold for antidiuretic hormone activity, increasing plasma volume and extracellular fluid. This can make someone look smoother, not because of fat gain, but fluid redistribution. Total body water is influenced by testosterone, growth hormone, aldosterone, injection frequency. Blaming estrogen alone is an oversimplification. Mood, temperature, and stability. Mood issues are rarely caused by estrogen alone. They occur when estrogen is too high, too low, or fluctuating rapidly. Hormonal instability is often the real problem. Estrogen also regulates body temperature. Low estrogen can cause night sweats and thermoregulation issues. Stable hormones mean stable mood and recovery. Labs, ratios, and coaching reality. Never chase a lab number in isolation. Ultra-sensitive estradiol testing is essential. Estrogen values mean nothing without context. Androgen dose, body fat. Symptoms. Enhanced athletes can feel great with estradiol levels far above reference ranges when androgens are also high. Problems arise when the ratio is wrong. Coach the person, not the lab sheet. Final takeaway. Estrogen is not the enemy. Health problems arise when hormones fall out of balance. Too much or too little estrogen in the wrong context creates pathology. The goal is not suppression. The goal is stability, balance, and long-term performance.
Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.